Hello friend, welcome to this channel Nursing Knowledge. Today we are going to solve the ccras 2019 paper which was held in second shift, and this is a part 1 video. Question number 1. The back pressure arm lift method of artificial respiration is known as option A. Holger Nelson method, option B. Stefanik method, option C. Rogerbug method, option D. Henry Hamlich method. The correct answer is option A, Holger Nelson method. Next question. Which of these in an independent nursing function? Option A, applying a warm soak on an infiltrated IV site. Option B, irrigating a patient's wound with normal saline. Option C, limiting fluids when the patient has an intake order of 1 liter per day. Option D, assigning another nurse to administer medication. Correct answer is option D, assigning another nurse to administer medication. Next question. The causative organism for tapeworm infection. Option A, Taenia solium. Option B, Trypanosoma cruzi. Option C, Leishmania donovani. Option D, Enterobius vermicularis. Correct answer is option A, Taenia solium. Next, an angry nurse defames the patient through her comment that he is rude and domineering. This is an example for option A libel, option B battery, option C assault, option D slander. Correct answer is option D slander. Next question. The assignment by chance of intact group of participants rather than individual participants to treatment condition is option A, cluster randomization, option B, quota sampling, option C, cluster sampling, option D, cohort randomization. Correct answer is option A, cluster randomization. Next question. While evaluating the patient for complications of acute pancreatitis, the nurse should observe for option A, decreased urine output, option B, bradycardia, option C, increased intracranial pressure, option D, hypertension. Correct answer is option A, decreased urine output. Next question. A child with chickenpox has to be isolated from other children in the school till option A, 3 days after the scabs are formed, option B, the scabs fall off, option C, 4 days after fever subsides, option D, 5 days after the development of pustules. Correct answer is option B, the scabs falls off. Next question. The nurse analyzes data critically in this step of nursing process. Option A, diagnosis, option B, clustering, option C, planning, option D, assessment. Correct answer is option A, diagnosis. Next question. An ethical principle that obligates faithfulness to commitment and responsibilities is option A, beneficence, option B, non-maleficence, option C, veracity, option D, fidelity. Correct answer is option B, fidelity. Next question. What is a type of fracture that occurs in children where the bone is bent but not broken? Option A, torus fracture, option B, green stick fracture, option C, buccal deformation, option D, plastic deformation. Correct answer is option D, plastic deformation. Next question. All are factors influencing socialization except A, limitation, B, laws, C, identification, D, language. Correct answer is B, law. Next question. An unimmunized pregnant woman reports for vaccination about 20 days prior to expected date of delivery. The nursing action will be to A. Advise passive immunization after delivery. B. Give one dose of TT and advise a second dose after delivery. C. Give anti-tetanus immunoglobulin. Option D. Give two doses of TT with 2 weeks interval. Correct answer is option B. Give one dose of TT and advise the second dose after delivery. Next, an indication for primary use of ECT is A. Severe agitation. B. Non-compliance with treatment. C. Major depression with psychotic features. Option D. Antisocial behavior. Correct answer is option D. C. Major depression with psychotic features. Next question. Which of these in an example for secondary reinforcer? Option A. Chocolate to the child for finishing homework. Option B. A cup of water for the thirsty child. Option C. Praising the child on completing task. Option D. Extra feed for the dog's jumping act. Correct answer is option C. Praising the child on completing task. Next question is all these are the right of delegation except option A right time, option B right task, option C right person, option D right place. Correct answer is option D, correct right place. Next, the alert signs for ectopic pregnancy are option A prolonged epigastric pain and copious vaginal discharge, option B amenorrhea and negative pregnancy test, option C abdominal pain, vaginal bleeding and positive pregnancy test, option D hyperemesis and weight loss. Correct answer is option C abdominal pain, vaginal bleeding and positive pregnancy test. Next, a vitamin that functions like steroid hormone. Option A and D, option B, B and E, option C and A, option D and B. Correct answer is option A and D. Next question is the immediate action to control severe bleeding is option A, apply dressing pad, option B, immobilize the injured part, option C, place the person in a suitable position, option D, apply direct pressure using hand or cloth. Correct answer is option D, apply direct pressure using hand or cloth. Next, while assessing the neurological function of a patient, the nurse performs Romberg test as a screening measurement for option A muscle strength, option B balance, option C coordination, option D sensation. Correct answer is option B balance. Next question. In which type of marriage the pairing of male and female is temporary and not bounded by rules and regulation? Option A Punaluvan, option B Syndesmian, option C civil, option D walking. Correct answer is option B Syndesmian. Next question. Insulin 10 unit in 50 ml of 50% dextrose is prescribed for a patient with chronic renal failure to reverse option A hyperglycemia, option B hypokalemia, option C hyperkalemia, option D hyponatremia. Correct answer is option C hyperkalemia. Next question. Humoral immunity is mediated by option A T lymphocytes, option B lymphocytes, option C suppressor T cells, option D natural killer cell. Correct answer is option B lymphocytes. Next question. The media used to grow fastidious bacteria is option A meat extract broth, option B chocolate agar, Option C. Tetrathionate broth. Option D. Peptone water. Correct answer is option B. Chocolate agar. Next question. The specimen collection that does not require the use of surgical aseptic technique is option A. Stool for ova and parasites. Option B. Urine from the retention catheter. Option C. Exudate from a wound for culture and sensitivity. Option D. Specimen for a throat culture. Correct answer is option A. Stool for ova and parasites. Next question. The staple food of villages of 3,000 population is maize. These villages are at risk for option A. Pitot spot, option B. Pelligra, option C. Beriberi, option D. Scurvy. Correct answer is option B. Pelligra. Next question. All these are features of phenomenological study except option A. Bracketing, option B. Emic ethic perspective, option C. Describing, option D. Intuiting. Correct answer is option B. Emic ethic perspective. Next question. The nurse observed the patient to be withdrawn and crying and conveyed to the patient that she seems to be sad today. The interviewing approach used here is option A. Clarifying, option B. Reflecting, option C. Examining, option D. Orienting. Correct answer is option B. Reflecting. Next question. If the number of deaths from dengue is expressed in relation to the total media population, it is option A. Age specific death rate, option B. Cause specific death rate, option C. Proportional mortality rate, option D. Case fatality rate. Correct answer is option B. Case specific death rate. Next question. The irrational and intense fear of traveling is option A. Hodophobia, option B. Aerophobia, option C. Agoraphobia, option D. Thanatophobia. Correct answer is option A. Hodophobia. Next question. Considering the leadership style, the term that suits a democratic leader is option A. Permissive, option B. Directive, option C. Oppressive, option D. Consultative. Correct answer is option D. Consultative. Next question. The physical assessment of a newborn indicates absence of femoral pulses. It is a significant sign of option A. Ventricular septal defect, option B. Aortic stenosis, option C. Coarctation of aorta, option D. Patent ductus arteriosus. Correct answer is option C. Coarctation of aorta. Next question. Painfulness, order, and systemization are associated with option A. One-way communication, option B. Two-way communication, option C. Interpersonal communication, option D. Serial communication. Correct answer is option A. One-way communication. Next question. The defense mechanism used by a lady who is unable to bear a child engages self in working with children is option A. Sublimation, option B. Compensation, option C. Identification, option D. Displacement. Correct answer is option A. Sublimation. Next question is the document that notifies the central venous catheter care that includes the frequency of tubing change, type of fluid used for flushing, frequency of dressing change, type of dressing material to be used, and other aspects of care is option A. Institutional policies, option B. Care pathways, option C. Standard of care, option D. Protocols. Correct answer is option D, protocols. Next question is the term cultural lag was coined by option A, Max Weber, option B, William Ogburn, option C, Emile Durkheim, option D, Karl Marx. Correct answer is option B, William Ogburn. थैंक यू फॉर वॉचिंग दिस वीडियो। अगर आपको ये वीडियो पसंद आया है तो लाइक ज़रूर करें और इसका नेक्स्ट पार्ट देखने के लिए चैनल को सब्सक्राइब करें।